In the beginning, we set up what we call our hospital incident command system. We had an incident commander, and each one of us who participated in that had our distinct roles. Yeah, so in this case, we put our incident command system in place. It wasn't a one-time event, it was an ongoing event. It was an event that was a pandemic, something that we have never experienced before. So we assembled, we met daily, long hours in the beginning, and then it included weekends to try and figure out, okay, exactly what's going on, trust our instincts, but as this information's coming in, how do we organize ourselves in a way to respond to what was going on here locally? Well, the second thing we learned during the pandemic was to rely on a network, and not in the usual sense. We're not part of a large health system. So we don't have multiple hospitals and resources of a larger health system to depend on. So we depended on our neighbors. So it included some of the smaller hospitals in the outlying communities, some of the larger hospitals in Lincoln and Omaha. We have service relationships with some of those hospitals. So from time to time, we would ask questions, we'd identify things that we might need, and we came together as a state to respond to local needs in these various communities. As a community, the community rallied to help provide us as healthcare providers resources that we typically wouldn't ask for. So we were running out of hand sanitizer. So Kappa Ethanol responded to make sure that we would have access to, they produced hand sanitizer for us. And in addition, there came a point in time where we had so much success in finding supply, particularly masks, and we took some of our masks and we donated them back to local law enforcement to make sure that they had enough masks for their work. Another major area had to do with our people. And first of all, what we found out is there were places in our healthcare organization where we needed to take care of a lot of COVID patients coming to our hospital. And in those situations where we had extreme demand, we had to go to departments who wouldn't normally take care of COVID patients in their areas and ask them to be flexible and help out their peers in other parts of the organization to task assist. And so we had the good fortune to have a number of individuals in the organization who were flexible and willing to support their peers in other places. In addition, we decided, because people were afraid to come to the clinic, those people that had respiratory type conditions, rather than have them come into the traditional clinic setting, we set up a trailer for respiratory patients. So we mingled people with respiratory conditions that may or may not have had COVID, but we did our COVID testing there. We continue to do that today to help patients who didn't have respiratory symptoms feel safe. In summary, as I reflect on this last year, the thing that I'm absolutely pleased about is the flexibility, the resilience of our workforce, our physicians. We are extremely grateful for the community, how the community has reached out to us and taken good care of us while we've taken good care of them. We've had local businesses bring us food. We've had local businesses bring us personal protective equipment. We've had local businesses share emotional and mental support through thank yous. That's extremely important as we've dealt with this pandemic the last year. And as far as resiliency is concerned, I'm really proud of how people were able to handle the balance between personal and work life during all of this, and how we've really band together to take care of each other.